Hello, everyone. Good afternoon to this session on AI, which already began in the last session. So we're going to start quickly with the introductions. I'm editor-in-chief of MedCity News. If you don't know what MedCity News is, we've been around since 2009, and we cover innovation in healthcare. Amir, to you first.
Yeah. Good afternoon, everyone. Amir Azarbad, I'm the managing director of our healthcare practice at 10 Pearls.
Hi, everyone. It's great to be here. Thank you for having me. I'm Ainsley MacLean. I'm Chief Medical Information Officer and Chief AI Officer at the Mid-Atlantic Permanente Medical Group, who has the privilege of taking care of the 850,000 patients of Kaiser Permanente in the Washington, D.C. area. Thank you.
Good afternoon. Eugene Sayan. I'm the CEO of Softheon. And Softheon is a, how do I describe it these days? It's going to be a little difficult one, but I'll tell you the best part of anyway, the main work we do is about helping 6+ million people on ACA with access to enrollment and affordable care, and in partnership with over 100 health plans.
So the pace of change in healthcare is kind of like watching me come up onto the stage. It is slow. However, it seems like in the past 6 to 12 months, generative AI has sort of taken over our collective imaginations, and it's like upending everything. So I wanted to start there. Everyone that I've spoken to at this conference has said, AI is not new. We've been doing it for a very, very long time. So I was hoping, Ainsley, maybe you could start to unpack why this sudden great interest in this shiny new object.
So I love when people say that it's not new, because it was new for me. So I'm a neuroradiologist by training, and I had mostly done technology and radiology leadership and operations for many years. And then I stepped into the shoes of Chief Medical Information Officer in about September of last year. And I think within a few days, I got a text from our executive medical director being like, have you seen this ChatGPT thing? We need this yesterday for everything. And I was like, all right, this is going to definitely set the course for us. So I think what it does is it's basically become a household name. And I think that there's a lot of power with that. When we take technology that maybe was known and loved by data scientists across, academic centers in this country, and then we put it in the hands of consumers, our patients, our physicians, it just becomes a game changer. So I really think that that's what it is. It's just so end user friendly.
So Eugene, to just pick up on that, you were one of the people who said this is not new. We've been doing a bit of AI and everything for a really long time. So to you, this is not something novel. How do you parse through what can be achieved today with all the things we know about AI and what we've been doing in AI for the past 10, 20 years?
Absolutely. I mean, from an example point of view, if you think about it, right? Many years ago, we've been promised about autonomous cars. And God knows how much money invested into autonomous cars along the line, and we still don't have them commonly, or if nothing else other than experimental. But along the way, we have introduced the technologies such as LiDAR, such as blind spot detections, such as lane corrections, and others. So it's a kind of an evolutionary process in making as we speak. I think the exciting thing about or appealing part about ChatGPT is kind of the Cinderella moment. All of a sudden, that overnight, everybody's starting to look, wow, what this is possible with generative AI. But if you really look into some of the technology companies for many years have been adapting what we now call it a narrow AI, which is the basic premise around supervised, in some cases unsupervised learning, and machine doing more and more human works. I'll give you from a ratio KPIs-driven approach, I'm sure you all are. We manage, like as I said, 6 million lives, and companies only about 300 people. Can you imagine a health insurance company with managing 6 million lives and 300 people? And this is the kind of innovation it's been in making for a long time. Generative AI, it literally became like the window dressing to this amazing experience.
So Amir, you work with a lot of payers, and given this sudden great desire to have everything AI, are the projects that you're getting from these companies different than what you got, and do they always use a level of automation that you've not seen before in terms of requests from payers?
Yeah, the payer space is very interesting these days, right? There's the shiny AI object, so all our clients are asking, how do we use it? And then there's the reality of a complex organization with very significant sort of technical debt, if you will, the legacy systems, the conversation before this around the data upstream, focusing on that, getting the data back downstream. So in our conversations with our payer clients, we do a lot of sort of level setting. Shiny objects are great, and I think you need to go towards that. But we always try to bring it back to the, what are those good use cases that AI can really drive change within, administrative cost savings? How do you automate some processes, or how do you take advantage of these to allow your nurses, your doctors, your staff to focus on the important stuff, or focus on, give them information the way they want to see it versus the way they get it. So they're not sorting through thousands and thousands of pages of sort of notes, if you will. So there's definitely a ton of good AI use cases, and then there's a lot of excitement around what could be. So it's always about a level setting with the payers right now, and trying to just be very candid and pragmatic with, like, look, you can do this, you'll get there, but let's focus here. And it's a difficult conversation because no organization wants to fund a modernization effort or a change in how you acquire data, or how all of that works.
So I know, Ainsley, you mentioned ChatGPT and how that was fascinating. I don't know if you guys have ever done searches on your own names in ChatGPT. I have done it. My parents would be proud of that individual. I am not that person. So data accuracy is so key because it's garbage in, garbage out. So when that person who told you we should have ChatGPT yesterday, I'm assuming you don't have ChatGPT in Kaiser, and you're looking at more accurate ways of doing sort of the same thing.
No, it's a great comment. I'll have to look myself up in ChatGPT because I haven't done that. I think our strategy has definitely honed itself over the last 11 months. And we've gone to a point where we now have really 5 pillars of our AI strategy within Kaiser Permanente. And the first, believe it or not, on the physician side is physician leadership and education in AI. Because we know that 90% of AI projects fail. And why is that? We don't have the right people around the table. And so the way we do it is through what I call like a table stakes. When I have a really excited physician who comes to me, let's use AI in this, one of the things I first recommend is getting certified through the American Board of Artificial Intelligence in Medicine. And that's something we've had close to 50 physicians across Kaiser Permanente do. And it helps them to sit around the table with data science, with finance, with our engineers, and kind of come up with a thoughtful approach. I'll go through the other 4 buckets just really quickly, if that's okay. The first is in the area of ambient listening. So when, as a physician, I'm sitting there talking to a patient, I can use AI to capture that so I actually can look at you as you're speaking to me. And I will say our Kaiser Permanente physicians are amazing with the electronic medical record. We have one of the most robust systems in the country. They're very fast, but something like ambient listening, which we are looking to implement shortly, will allow them to focus even more. The second pillar is within our patient portal, as well as within remote monitoring. So anything where it actually touches the patient and we can help influence them and get them to their care more quickly. The third is within the electronic medical record itself. And so obviously with that, we're working with big partners that we have in that space to ensure that everything our physicians do can be streamlined. And when you talk about security, safety, data, none of the pillars is going to be more important than that one. And the fourth really is in the area of anything that touches images. So that could be a radiologist, my space, it could be cardiology, gastroenterology. And when you look across KP, we're thinking definitely with an enterprise lens, as well as looking to put as much as we can within the cloud as we approach that. And we recently are contracting for a large enterprise PAC solution, which will allow us to leverage an AI marketplace. And the final is sort of what you talked about, business AI. And how do we leverage the power of our analytics? And we're looking at several different areas within that as well. So I think we've gone from we need ChatGPT to a very sort of thoughtful approach that really supports physician leadership.
So before I ask a question of Eugene, I just wanted to tell you guys that you can send questions through the Health app. So you have to find this particular session on the agenda and then click on it and then click Attendee Q&A, click on Insights Program. And after that exercise, you can actually type in a question and I'll see it. So Eugene, when we were prepping for this discussion today, you had this fascinating quote, and I don't remember who it was from, but you said, "The mission of healthcare is the preservation of dysfunction." And I thought, wow, if everything that is wrong in healthcare is actually encapsulated by that single statement. So do you think AI can be a force for good that can change that quote a little bit?
Well, I don't know exactly who to credit for that quote altogether too, but would you believe if I said the health outcomes factored by 40% social environments, 30% your health behaviors, 20% clinical care, and the 10% of the physical settings, hospitals, doctors' offices. And this was a study published by the US National Institute of Health. So 40% of our health and well-being is determined by social determinants. And another 30% is by how we behave and act. So our mission in healthcare, not that we have any core competency in the clinical areas, but we feel that it will be better served if we were to focus on the consumerism aspect of healthcare. And so for that reason alone, over the last several years, we focus on three primary areas. One is what we call the consumer journey. To this date, shopping and enrolling the appropriate and the correct health plan is probably one of the most complex and most troubling experience for any consumers. I mean, I would love to ask the audience in here, can you rate the health insurance shopping experience compared to any other industry, such as airline, travel, hotels, banking, right? No disrespect, it's consistently being ranked among the lowest consumer experience among any other surveys. So our next area is now we are focusing on heavily into the consumer insights, understanding exactly what really happens with that consumer. What is the correlation between the, let's say, the behavioral health versus a sleep disorder versus a severe depression? There is a correlation, and statistically proven, and we have basically worked with multiple health plans. There was a great report we published last year with Cambia Health about the effect of exact topics altogether too. And then the third component is the consumer persuasion. And this is an area we believe that AI will have tremendous impact. Now with that comes a lot of responsibility. Hallucination, false reports, narrations. In the data science world, as we call it, you torture the data, it'll confess to anything. So you have to be careful around the data, the model that are being used, and that are being shared across everybody. But this is a big responsibility, absolutely.
So Amir, wanted to talk to you about the pain points that payers have specifically that can be addressed by AI or health tech. I mean, we constantly report on how the American Medical Association is so mad with payers and that EHR is no longer as big a headache as prior authorization is. So I'm wondering when, there are smaller plans out there that want to, be on the right side of the AMA or not want to have a good relationship with providers in the network, are they coming to you and say, hey, help us find solutions or develop solutions that will tackle A, B, C, D, and what are those A, B, C, D?
Yeah, I like that preservation of dysfunction. Might have to use that a couple of times. Yeah, so I think there are some really sort of practical use cases of AI today that could significantly help, right? I mentioned a few minutes ago around the whole notes, and authorization is really a space right now that is getting a lot of attention from everybody, and because it's a pain point for the providers, the payers are having a hard time with it. They're trying to remove it. There's the pre-auth. If you go through that chain and the activity, and that's the main interaction between the payers and the providers, there are some opportunities there. The payers continue to hire and staff up folks to just do administrative work. Just clean up a case, move a case through, write notes, whatever. Nurses and doctors are looking to do reviews. They're spending, half an hour reading through all of this. AI has a real, practical use case there where they can take all of that information and provide the actionable and the pieces that are important or necessary for decision making. So that's a big area of conversation. The other area of conversation, frankly, is payers spend a lot of time authorizing services. There's a lot of things that happen. Machine learning, and this has been talked about for the last 10 years, has nothing to do with this new generative AI stuff. They've been talking about machine learning being able to understand the data and automate the authorization process. So if you think about a funnel, if you've got 100 cases, chances are 80 to 90 of those should be auto-approved based on historical decisions. And then now you're letting the folks that are looking at cases look on that 10 and make the right decision on those 10 authorizations. So if you think about the authorization process, that is really at the forefront of where a lot of the payers are looking at AI at the moment. There is on the shopping experience, on the buying, on the benefit side at the front end, and then on the claims matching side on the back end. There's this whole conversation of, I think people forgot about blockchain. That was the, everyone's talking about AI, no one's talking about blockchain, but blockchain was one of those things that was being talked about within the payer space around, is there a way to create some unique connections between an auth and a claim so that you don't have to go through all of this matching process, making sure the payment integrity that it's paid right, all those kinds of things. So some really good practical use cases out there for sure. And obviously there's some soapbox stuff we can go on in terms of what they think AI could do.
Ainsley, I know this is a payer insights panel, but I do, since you represent a provider group too, I just wanted to ask you about where AI can have good effect on the clinical side. Now, in this conference, I've heard both sides. In just the previous session, you heard a lot of skepticism about how you don't want to use AI in the clinical setting. But then I'm thinking of radiology imaging, right? AI has been looking at radiology images for a long time, and presumably that is the most advanced use of AI in the medical world. So should we shy away from using AI in a clinical setting?
So I'm not really afraid of it at all, as long as we have the right people at the table, like I said before. I think that at the end of the day, when you look at where we are right now across many occupations from a staffing standpoint, and then we have the power and productivity that AI can unleash, it's kind of a no-brainer from my standpoint. I'll give an example sort of on the payer and provider side of how we leverage technology within Kaiser Permanente to really impact lives. So we do about 500 screening mammograms a day just in the Mid-Atlantic. Of course, we do hundreds of thousands across all of Kaiser Permanente. And our radiologists decided, why should women have to wait? It's actually, the requirement legally is about 30 days. I don't know if you'd want to wait 30 days for a mammogram. But our radiologists decided, women should not have to wait more than 60 minutes. And we did that. And we used a series of technology in order to provide essentially population-level care across 850,000 patients, 500 screening mammograms a day. So our women come in, they have a mammogram, a 3D mammogram or a 2D. They head out to the parking lot, their phone dings, they get a message saying that you had a normal mammogram, we'll see you at the next time when you're due. And we've taken it a step beyond that because of our integrated model. When our physicians order a screening mammogram, we're able to automate that process. So it covers them from a screening mammogram to a diagnostic mammogram, to a biopsy. And one of the things I'm imagining with AI is why can't that be something that is leveraged in order to help make that process available elsewhere? And so we'll certainly be looking at that. We are looking at AI and screening mammograms. The one thing I will just say, since you mentioned imaging, and I was in a room about 10 years ago with about several thousand radiologists in which the guest speaker informed all of us that we wouldn't have a job in about 8 years. You can imagine that went over really well. But we took it as a challenge. So Radiology now is the #1 publisher of all AI-related articles, which I think we're really proud of. Interestingly, AI can't train in comparisons yet. Right? And so for any of you who know radiologists or you know a dentist even, the way we determine an abnormality even in screening mammograms is looking back and forth very quickly from a prior, which is why getting that annual or biannual screening mammogram is so critical, because we're looking sometimes back 2 or 3 years and we could say, you know what, we don't need to see you, it actually was here. And so that's one of the limitations. So even now, although breast AI, I think probably shows the most promise of almost all AI and imaging, it still will flash up a lot of things. And you're like, okay, well, I would have dismissed 49 out of 50 of those. They wouldn't have even occurred to me to call, but the AI is not quite at that point where it can dismiss it. But I think we're going to be there, and I feel really excited about it.
Okay, so a few questions from the audience has come up. Eugene, I'll field one in your way. How do you balance the force for good of AI amongst revenue gain, health impacts, and CX without massive disruption in operations and employee morale? That's a tough one.
That's a tough one.
Tell us.
I'm the lucky one, I guess, huh? Okay, well, I think there are a couple of things, not just the one or two things altogether, that starting with Ainsley's comment, you want to have the right group of people around the table. AI is here. It's no longer a science fiction altogether, too. It is a non-biological evolution. Within a few years, we're going to see significant improvements or enhancements in AI. We talk about human intelligence in 150 or 160, Einstein and Elon Musk 155, and GPT 3.5 have achieved that level of sophistication. For those who are familiar with what's called a Turing test. Turing test is basically an individual has engaged in a conversation with a computer and a human to the point that the observer cannot distinguish which one is computer, which one is machine, the human. GPT 3.5 already passed that test. It's already passed bar exams and everything else. And GPT-4 is a 10 times improvement, okay? And this is already happening just within 1 year. Can you imagine GPT-6, another 10x improvement? Within the 2 years, we will be dealing with an entity. I don't think they'll be sentient, meaning that they are not going to exhibit any kind of sensation, emotional beings. But just like we saw Mr. Spock crying at some point in time, he showed that he can become a sentient. We will deal with entities 1,500 in the IQ scale. So this is the important aspect of AI, understanding what is the true nature and how we govern it. And this is why this is such a big topic about the regulations and governance and everything else. The other important part is we need to encourage organizations, especially payers and providers and government, to share data. Data interoperability, data sharing is paramount to this process. If we don't do that, the future AI models will not have the benchmark data. In other words, it will be almost like imagining the Galapagos Island of AI. Every organization will continue to train their future models using the data. And that is a very dangerous trend because now you're dealing with synthetic data, most likely. It's not even a natural data aggregation. And this will accelerate its speed without any benchmark, without any comparison to other models, other data sets altogether too. I don't want to sound doom and gloom, but this is going to be a very interesting and to a certain extent concerning, kind of a little bit of a stochastic view. I don't want to be too cheerful about this. I think, yes, they will create a lot of jobs, things like prompt engineering, things like skepticism. I mean, somebody has to review and evaluate every answer these machines are producing, whether or not this is meaningful. So buckle up. It's going to be an interesting ride.
Amir,
Yeah, let me just one quick thing in terms of, because that's a really important point there. There are people who are scared of AI, and there are people who embrace AI within the payer space, right? One of the things that we always talk to our clients about is take care of your people, the change management, the conversations, communicate to your folks why it is better and what we're doing to make it better, because everyone's fearful that AI is going to replace my job tomorrow, right? So then that's the big operational risk of the payer starting to run out there and saying, we're going to do this, we're going to do that. Your employees are going to start feeling scared, right? And that's it's you have to embrace AI. I think there's significant benefits that will come out of it within the payer space, but at the end of the day, it is an operational disruption, and the best way to manage that is by just managing the change to your people, explaining the why, and then bringing them along for the ride. And we do a lot of that with our clients, and it helps. You're never going to get everyone not to be scared, but at least it helps them feel comfortable. And then when you've got champions embracing the idea of, AI is going to make my job easier, that's a much better conversation than AI is going to replace my job.
I totally agree with that. And if I could just give a real world example. So I became a believer in AI when we first started using a product actually in our radiologist dictation. So not in the image interpretation. And it was a really simple, elegant solution. So for any of you who've had imaging done, there's the long radiologist report. A lot of people don't read that part. And then the impression, and most of our referring providers, they go straight to the impression. And so what this solution does is it analyzes the content of that long part no one reads across 10,000 of my, personally as a radiologist, prior reports. And what did I say in the last 10,000 times I dictated those findings? And it puts it in the impression. And when this first was presented to me, I was like, well, that seems like not really that helpful. Why do I need AI to help me with those last two sentences? And at the end of the day, it's because 80% of the report cognitive burden and thought that is going into that is me as a radiologist synthesizing all of those findings and making my recommendation. And so I covered night shifts. And I noticed the first 2 times I used this product that the next morning I was able to drive my kids to their sporting events, and I felt like I hadn't worked a shift, and I'd read 100 studies. So I'd done the exact same thing. And so when we present a solution to end users that actually makes their life better, I think it becomes a really win-win solution. And I have to give kudos to this particular company. I think one of the best things about AI is we have literally the smartest people in the room. Look at this conference, right? Working on healthcare, which is great. So it's really fun to be there. When we presented it to our radiologists, you can only imagine the reaction we got. And at the end of the day, the company said, bring it on. Like, I want to talk to your most productive users, because the people that are the radiologists that are really fast are like, I don't need this to be faster. And I want to talk to your slowest users. And I think we have to be open to feedback. I know for myself, I work on that. I don't take criticism particularly well. And we listened. And now through our radiology reporting, I think we've written like 10,000 Harry Potter books worth of impressions using AI. And to your point, everything that's signed off on is signed in my name. So I am 100% responsible for the content of that impression. And we kind of compare it to a very smart resident. So, a very smart resident maybe would help me if I worked at a large academic center. We do have some rotating residents as well at Kaiser Permanente. And I make that decision, I add some tweaks, but I have to tell you, there are times when I dictate the findings, I click on the impression, it essentially is giving a diagnosis, and I'm like, oh, that sounds pretty good, and I realize it's because that's what I said, 3 or 4 years ago. But at the end of the day, I think that's win-win for everyone.
so here's a question for Ainsley that I'm actually going to try to answer first.
Thank you.
Very boldly, and then you can take it, Ainsley. So the question is, Ainsley mentioned AI use in the patient portal. Could she speak more about that? I'll speak first, and I'll give it to you. So I'm currently a patient with a broken left foot. It happened 2 weeks ago. It happened on a Sunday. Monday, first thing in the morning, 8 o'clock, I call my primary care physician and tell the person who took the message that I need an x-ray, essentially. I don't know what's wrong, but I can't walk. She said, okay, I'm gonna send the message to the doctor. No response for an hour, and I'm not the most patient person on the planet, so I call again. This time, no, I didn't call again. I sent a message to them. Again, they don't respond for another hour, and then they say, oh, she's actually out for the day. Maybe you should walk into or call into an urgent care location. Stupid me, I walk into an urgent care location, in noon. It was also an imaging center because that's what I wanted. Well, they were completely booked out for the entire day. Then I called back, and I said, well, who's the physician covering for her? And lo and behold, 2023, United States of America, Northern California, no one was covering while the physician was out. Now, when I was sending the message, had the message been received by an, clever AI engine who knew that the physician was out for the day, maybe it could have told me at 8 a.m., go to the damn urgent care center, right? So that's one use of how AI could be used in the patient portal. Ainsley, you have a better example, so go ahead.
So thank you for sharing that. Please tell me you're not a Kaiser Permanente patient.
No.
Okay, all right. I see some colleagues here from. Okay, all right. I was going to say that doesn't sound like our experience, but I just want to make sure. So so sorry for that you have that. So I think you're spot on, and you touched on it in a few different areas. So one is really when you're entering that patient portal, there's AI and there's not AI. So we can help triage through a variety of means to get you where you need to go quickly. So do you need to see an on-demand physician? So we have on-demand video visits with our Kaiser Permanente providers. Do you need to actually maybe just have like what we call a chart review? So we know your ankle's broken and swollen. Do we really need a physician to review that, or could we just generate an order for an x-ray? And so I think that's one of the areas we're looking is sort of at that, what we're calling, hi Dave, I'm seeing Dave, one of my colleagues from Southern California, Kaiser, we're calling that self-triage. So how do we help patients better self-triage and also take advantage, yes, there is a shortage of physicians, right? So how do we make sure that we can get patients to what they need when they need it? And I think that's where there's tremendous potential is really on that patient front door. I don't know if that answered folks' question.
I'll add another use case to the similar stories altogether too. One of our biggest problems in ACA being that, federally facilitated, government-regulated tax subsidies, there are so many rules and, the complications around the basic questions altogether too. And call centers, ironically, pretty much the universal, the business model is that no disrespect to anyone else here, but they're not qualified. I mean, you're lucky. You'll have a 1 or 2 CSR knows what they're talking about it. So we partner with some of our health plan partners. Going back to the example, we took the best CSR, and we have our entire wiki is being trained with our version of we call AMI, Artificial Intelligence. We did a for enterprise. And we are able to do exactly what you just asked for. As a consumer, as a patient, you're looking for fast, accurate answers. Having said that, we are doing all possible testing necessary because it's so dangerous to putting a tool like that in front of a consumer because implications are severe, especially in a regulated space like healthcare.
Okay, Amir, one question for you. How does the industry combat competing AI? In other words, some want prior authorization to go away, others that want it more stringent. Won't this generate an AI boxing match? Great question.
Yeah. I mean, the boxing match. Yes. I think AI is a solution, a technology, an enabler, if you will. I think the point of that question is more about the payers and the providers coming together. And it's more about the business and how the industry has to change and work through the authorization process. AI will enable it one way or another. It'll knock it out whichever way they decide to go with it. But I think at the end of the day, that's more of a strategic sort of shift in the industry and how things are done, whether it's gold carding providers and letting things go through, or just getting rid of it altogether and doing some post reviews and stuff. There are many ways around it. I think AI will just enable whatever that shift in strategy is.
And I was going to say, we use AI to flag certain things. So had you written in, that happened to be your ankle, but had you written in and said, I'm having severe chest pain, that's not a message that should come through the portal. So we have AI which is able to identify that and essentially quickly route you so that that's not something that's sitting in someone's in basket. So I think that that's another great use of it.
Yeah. So we're pretty much out of time. So final thoughts, starting with you, Eugene. If a pair who has not really considered AI but now feels pressure to look at it and adopt it, where should they begin?
Well, I think it's a good place to begin with just understanding and analyzing your data, because the data is the gasoline that you're going to put into this engine, and AI being the engine itself too. The quality and accuracy of the data that you're going to train your AI models. And these models are going to proliferate. What we know is just ChatGPT is one model. As you know, Google has another one, and then we're going to start seeing more and more of those models available. And what's important, even not to fall into the trap of that, is my AI is better than the other competitors. I think this is why the data transparency is critical to the conversation, because you want to be able to go down the path of second opinions, even in the utilizing the AI process, so that you want to be skeptical of your own answers. And this is going to make us all, in a way, more self-aware where our strengths or weaknesses are. A good place to start, in all honesty, I think, just like Ainsley indicated, that education is paramount. This is a very new territory, completely uncharted space. So read as much as you can, partner with organizations that are listed in organizations like Gartner. Gartner is one of the well thought out thought leaders. They publish multiple reports, and depending upon your needs, that you can find those sample vendors. They don't endorse any vendors, but you can find those vendors who can team up with you, and hopefully in a group settings that you're able to find the right people around the table.
Excellent. This was a wonderful, wonderful panel. Thank you so much for all your insights today.
Thanks for having us.
Thank you.
Thank you.
Everyone.